It's now my job to introduce the next speaker, and the gentleman that I'm about to introduce wears many hats. So first of all, he's a pharmacist, an academic, a principal enterprise fellow in pharmacy in the University of Huddersfield. Since graduating and gaining his PhD in pharmacy practice, his career has spanned community practice, health promotion, academia, research, guideline development and voluntary work. Dr. Patel has a keen focus on education and advancing the pharmacy profession. He has pioneered an innovative student champions programme with NICE, and he has also adapted this model specifically for the pharmacy curriculum in the UK, which is now rolled out in all schools in the UK bar one. Thankfully, he's looking at running that programme here in Ireland, and hopefully we'll get a chance to work with him on that as well. His research centres on developing and delivering health education programmes to a diverse range of minority ethnic groups most prone to diabetes and cardiovascular risk. He is, and there's a long list here, so wait for it, a National Pharmacy Board member of the Royal Pharmaceutical Society, Principal Enterprise Fellow in Pharmacy, Honorary Lecturer in the Medical School of University of Sheffield, Adjunct Professor of Pharmacy in Wilkes University, Pennsylvania, the USA, Consultant Pharmacist at the Safety Drug Research Unit in the University of Southampton, a Fellow of the National Institute of Health and Clinical Excellence, a Vice Chair of the NICE Accreditation Committee. Among his many prestigious awards is winner of the BMA Patient Information Resource of the Year Award in 2012, the BJM Diabetes Team-Based Award in 2015. He has been awarded a first in its kind Principal Enterprise Fellowship in Pharmacy, and also just recently for his work on the Champions Programme, the Royal Pharmaceutical Society has awarded him the Royal Pharmaceutical Society Charter Award 2016. So with his wide-ranging experience and interaction with professional bodies, charities, universities and students, we are fortunate to have him as an international advisor for the ePrePP project, and we believe that he is a very fitting representative for this project, which is focused on facilitating students' transition from being a student to a professional practitioner. So just very briefly, I mentioned to you that he has been recently honoured as a Fellow of NICE, or I say that NICE, a Fellow of NICE, and I can definitely testament that he is also a very nice fella. So it gives me great pleasure to introduce Dr. Mahendra Patel. So thank you, Mahendra. These are your notes. You're very welcome, and thank you.
Good morning, everyone. It's a great pleasure to be here. I don't know about after Eileen's intro there, but however, and all those that are not in the room here as well, hello and good morning. Thank you, Henry, for inviting me here. It's an honour to the college here as well, and promoting the works of ePreP and how it can enhance learning and practice development. I was told by Henry with a strict warning, don't crack any jokes because that's my part. So I'm not going to make anything light-hearted in any way, and I'm just going to dive in really. I'm going to talk a little bit about, let me get this right, give you an overview of the role of the General Pharmaceutical Council, how it relates to everyone here. The General Pharmaceutical Council carried out a survey on trainees and tutors in their placement. And it was a national survey that they did in 2013 and 14. First they did it with just tutees, and then they did it with tutees and tutors. So I'll share some of those results with you and their experiences. Also, as a board member of the Royal Pharmaceutical Society, gives me a great pleasure to actually share and promote some of their work and how it can enhance your learning and experiences as well, supporting students and tutors alike. And also, I think, to bring that into practice, some of the, we've heard from our colleagues here, David and Anne, who've mentioned placements in terms of other areas of engagement as well, and how we can see the problems behind that, but also the challenges, but also opportunities in terms of having new placement settings for the future. So the General Pharmaceutical Council is the council that is equivalent to your PSI here. So it's a regulatory body. It is there for approving qualifications of pharmacists and technicians and accrediting education of training providers. It also sets standards for conduct, ethics, proficiency, education and training, and equally CPD. It establishes and promotes standards for safe and effective practice at registered premises wherever you are. The other thing is, it is responsible for establishing fitness to practice requirements and dealing fairly and appropriately with any complaints that have been received. So that's equivalent to your PSI here. So following on from the pre-registration survey, as you can see, I think everybody can see at the back, can't they? This was just opinion-based, and as I've said, there was two parts to it. And the first part informed, which was the 2013, which was an online questionnaire purely for trainees. I'd just like to get a little bit of a grasp here. How many trainees, when you're in your placement, how many people here think that they've got the maximum out of their placement? Wow. None. Good. That's what I wanted to hear. So I've obviously got everything to gain on that ground in terms of what's coming forward. How many people think that the tutors have provided the best possible support? There's one there. Is that a hand up? Oh, was that forced? Right. A tutor puts her hand up. Right. So that means there's an area for improvement. And how can we work with that? The whole point of this survey was so that we can be informed by evidence, by your opinions from a tutee perspective, from a tutor perspective, so that that can inform debate, and we can then move forward in terms of what you want, what the tutors require, where there's areas of improvement, and what support can be put in place. So this is the survey results. Over half of the tutors had 5 years experience or less. So these are all the tutors that were surveyed, of which there was over 600 tutors online, and a third had completed the online survey. From a tutee perspective, there was over 800 tutees, and a third of those had completed the survey. Bearing in mind this was a national survey. So half of the tutors had 5 years experience or less. 70% placements were in the community, which I think you could expect because of the larger community engagement there that we have. 92% had a single placement. So there are some courses where we have split programs, but the large majority was the placement was continuous for that 12-month period. Up to 80% said they were satisfied and felt adequately supported. Unlike here, I think. Only 1% thought their trainee would rate their experience as poor or very poor. Yet, 75% of the tutees thought that their training was satisfactory. So there's a little disconnect there. This is a little caption of training years that it would take in terms of to preparing tutees to become a pharmacist. And you can see that that training year, the larger proportion of hospital pharmacists thought the training was better, supporting them in terms of their practice and development compared to community. But the other side to that is the larger organisations also provided a better training package in terms of the quality and support that was provided. So it was better for the hospitals and better for the larger organisations compared to the community. Henry, can I just say I need a timer because it's not long. Thank you. So overall quality of support, you can see that there's a great variation here. 56% rated their educational supervision and development was much less compared to hospital, 62% and 56% respectively compared to hospital. But interestingly, 51% only discussed learning progress with their tutors at least once a month, compared to 76% in hospital. So people in community practice was discussing their learning progress less frequently than our hospital counterparts. And perhaps again, there's an inequality there that we need to look at. The picture I'm trying to get across is there are inconsistencies in terms of the quality, the level of satisfaction, both from a tutor perspective and a tutee perspective. The feedback, significant difference in terms of the feedback received from community compared to hospital and larger organisations. And what was it? Was it that they weren't provided with enough support? Was it that the quality and the requirements, they were not aware of what was necessary? Was it that it was just something that they were ill-prepared for? And that's something we need to really establish and look at. This slide shows that 57% of those that completed the survey of the pre-registration tutors had 5 years or less experience in terms of tutoring. Yet, large proportion, 75% of that cohort, had actually been practicing for 11 years or more. So more than half had 5 years or less of training pre-registration students. 6 to 10 years, that was 25% and more, just over 25%. So there's a great movement here where we can actually put in support in place and areas for improvement. Access to support. Was it sufficient? Years as a tutor, you can see that 5 years or less, 11%, and 6 years or more, 6%. Did you know that when they were asked in terms of what they would prefer what would be their preferred option for further education, further training? Number one, the tutors said they wanted more training for dealing with difficult trainees, managing difficult trainees. Number two, they also wanted more support in how to give feedback. Number three, they also wanted more support in terms of assessment. So they wanted training. These were the three most popular items on their list for further training requirements. So, as a board member of the Royal Pharmaceutical Society, what does the Royal Pharmaceutical Society do? This is equivalent partly to your IIOP. It is there for members only, so it's a membership body. It's a professional body that leads the profession to improve the public's health and well-being and secure the future of all its members, but equally to build a workforce that is not only capable but confident as leaders in healthcare. That is a key role of the Royal Pharmaceutical Society. In terms of the symposium today, I'm going to focus on the fact that it's supporting the continuous professional development and improvement of our members. We are absolutely central to that as a professional body. But equal to that is recognising professional development through the career pathway of you as a healthcare professional, so in that case as a pharmacist. So from day one, from student level to the last day of your professional career. And it's recognising that professional development. So how do we do it? We do it through a series of structured reflective practice programs. The Royal Pharmaceutical Society are stewards of quality training and development of all stages of professional development through an accreditation program that sets the standards to grow, to advance and specialise alongside the challenging needs of patients and public today. It's there so that they can access support and guidance from tutees seamlessly, right the way through that programme. And I know you can't see the slides at the back very well there, but I'll follow it through. It also gives support to tutors to develop advanced knowledge, skills, and behaviours. So we're working through for a framework at the moment at pre-foundation level, which takes you through from undergraduate to registration period. It's an accredited programme which will underpin and follow and align the foundation framework that we already have once you've qualified as a pharmacist, and that is for 1,000 days. So the pre-foundation at undergraduate level is support and guidance right through your undergraduate programme to 1,000 days following and then beyond. And once you've got through your foundation years after becoming a pharmacist, it's then helping you to become advanced practitioners after you've qualified and gone through the 3-year period. And it's recognising that practice through a series of continuous professional development, assessment and periodic assessments, providing tutors, providing mentors on a one-to-one basis. And that's the progress. And we have the Advanced Pharmacy Framework for the foundation and the faculty programme in place. So the vision is all pre-foundation members to have access to professional support and guidance during their undergraduate studies, so the transition from sixth form college through the different years of higher education and then pre-registration training is seamless. This support will facilitate development and learning so that they are suitably prepared for day one of training and professional practice. That's the pre-foundation vision. And these are the key points from that perspective, is to facilitate development and learning right the way through that programme and to prepare you appropriately. We recognise that higher education institutions have a key role in supporting the programmes, and we would work with them to provide the necessary support and guidance. So the purpose of the pre-foundation is to complement and align the foundation for post-registration pharmacists. It offers a seamless transition from pre-foundation to foundation to faculty level. It also looks at mentorship and tutoring, which would provide exposure to being a mentee and a tutee, and that would qualify for the leadership requirements under the General Pharmaceutical Council. And it offers guidance to placement providers on in-course and vacation placements, so they will have guidance from the higher education institutions and pre-foundation and their expectation requirements according to the need. But also this would help towards your practice and become familiar with the continuing fitness of practice requirements that are in place. This is the vision, a needs-based, outcomes-focused approach to professional education, and need models of education and training delivery to ensure that all student pharmacists across Great Britain even enter the profession with the highest quality in education and training experience possible. The models of delivery need to be flexible to allow for the changes that we have and the innovative practice that we've got. And Anne mentioned we're talking global here. So we need to look at the global aspect as well, because we're not just localizing this to our region, to our area, but internationally as well. We provide a mentoring programme. Every member will be supported to develop and advance by tutors and members provided by the Royal Pharmaceutical Society at every stage of their career. They will be provided with guidance and support as well. I'll just talk about the variation that we had, and going back to the survey, you can see that even within Scotland, England, Wales, there's different distributions in terms of training patterns. And London compares quite differently to Wales. But Scotland have got more community placements than England, for example. And it's this variation and inconsistency that we have to be mindful of. The overall quality of support, I don't know if you can quite see this, but just to home in on that, you can see that London, only 49% formally discuss learning progress with their tutor at least once a month. And this is an area where we need to work and support and develop. So how do we help future placements? How do we increase the number of new placements? This was published in the Pharmaceutical Journal quite recently, and we're looking at role emerging placements that enable pharmacy students in all years to work with members of the public and learn about their needs. And this is an undergraduate course at Cardiff in Wales, where they're working with mothers and toddlers group and elderly care centres, so that they can share consultation skills, patient skills, and embrace what is the need, harnessing a little bit back to what Anne was saying. So it goes towards non-traditional pharmacy environments. And perhaps we do have to look outside now, because we're looking at a holistic practice here. This is another one that's an award-winning practice in London, supported by NHS England. And this was where we're looking at pharmacists going into GP practices and having their training accredited through that. But equally, the GP tutors are also coming into the pharmacy to see what they need to learn as well. So there's a two-way process. So it's a conduit for closer working relationships. And it's a part of the drive to upskill and equip community pharmacy workforce. And this is something going internationally with my position in America as well, where we bring in their rotational pharmacists here and we assess them through an e-portfolio and for a 4-week rotation program. I send my students across over there as well. And this is done electronically. And perhaps this is how we can fit in the ePreP to master that through. So the key messages that we have is this highly variable quality of tutor training in primary care. We need tutors that are fit for purpose, and we've mentioned fit for purpose and fit for practice even, with some way to measure this. What have we got in there? We need to ensure that all pre-registration sites provide equal quality training, especially in light of new and emerging placements. And the pre-foundation framework being developed by the Royal Pharmaceutical Society to provide appropriate mentoring and support to both tutors and trainees so that we get consistency right across the path. So that this, when I ask the question, how many people feel they were supported, you're not going to get these ups and downs. Thank you very much.